Medical. We are an online platform that helps patients from all over the world find medical procedures abroad. Why? Oh, I have to use the computer. All right. So why are we doing this? Because in today's world, there are still millions of people who can't afford or access healthcare, medical care, they need and deserve because of where they live. The reasons are manifold, and we like to think in three major categories. It's cost, quality, and access. Cost, basically, the patient just can't afford healthcare because of where they live. Quality, patients can't access healthcare because they don't have the right doctor, they don't have trust in their local medical system, or access, and this is a little bit more fragmented. This can be wait times, this can be regulatory issues where patients can't access care because it's frankly not available or not legal in their country, like gender reassignment surgery or types of reproductive medicine. My parents are from Cambodia, and I know so many people who would travel abroad to Thailand or Malaysia or Singapore too when seeking medical care. So I grew up thinking that medical tourism was a thing of third world countries. But when I went to the US the first time, I realized that even in one of the most richest, most industrialized countries in the world, there are still people who can't afford healthcare. And this is when I realized that access to care is a global problem. So looking at the world map, there are two general travel directions that you can see. Basically, one main travel direction is from Western countries in non-Western countries or industrialized countries into less industrialized countries. This is mostly the cost-driven stream. Oh, there is a Skype call coming in. And then the second travel stream is the other way around, which is mostly quality driven. Let's take a quick look at the numbers. Don't read through all the numbers, it's bad for your eyes. Let's just concentrate on the upper left corner where it says hip replacement. In the US, it costs $83,000 on average to get a hip replacement. And just follow through all the countries that you can see. You will see huge cost differences. And now imagine this is something that a patient has to pay out of pocket by themselves, 100% or a huge amount of it. But it's not only the cost that keeps patients from actually getting appropriate care. Again, lots of numbers. Let's look at hip replacement again. These are average waiting times for patients in the UK to actually get their treatment. For the hip replacement in 2015, it's 105 days to actually get that procedure. And that's just an average number. It's over 3 months. And on an international level, you can find in Germany, for example, you can get a hip replacement within 2 or 3 weeks. So the market is huge. It's growing very fast at 18–20% per year, projected to be at around $50 billion. I think the headline of all of that is that the market is just big enough. Now enough about numbers. I'd like you to meet Susan. Susan is a mother of 2 from the US. Susan has been overweight for her whole life. She weighs 130 kilograms right now, over 260 pounds. She's tried every diet, every weight loss program that has been out there. Meanwhile, she has diabetes type 2. She has difficulties breathing at night when she is sleeping. And the only way for her to get significantly better is to get weight loss surgery, a gastric sleeve. This is a surgery where you reduce the size of your stomach significantly. The problem is her American health insurance is not covering the cost. And paying out of pocket would mean around $15,000 for Susan to actually pay. Luckily, Susan met us, or we met Susan, and we found an excellent surgeon, board certified, highly experienced in Mexico for her, just 1 hour and 1 hour flight away from her hometown. You know what she spent? $4,500, less than a third of what she would have paid in the US. And she is not alone. Susan is not alone, and this is this is what we do at Juno Medical. We want to be an additional healthcare option for patients who might have ran out of options because of where they live. We want to empower patients to make informed decisions based on the transparency around availability of doctors, prices, qualifications, and destinations where people can actually go and get healthcare. The team that stands behind this is a rockstar team out of doctors. I'm not the only doctor at my company, and geeks. We sit in Berlin. We're 15 people, 8 nationalities. We speak 8 languages fluently. And this is what is getting us out of bed every day, helping patients from all across the world getting access to care. Because every patient in this world deserves affordable, high-quality care, no matter where she or he lives and how much money he has. So what better than to close with a few words Susan wrote us when she booked her appointment, which I would love to share with you. So what she wrote us was, I have battled my weight my entire life and done every type of weight loss program there is. My husband was ill for 4 years and died a couple of years ago. I have a 19 and 17-year-old boy. I want and need to be healthy for me. This is the first big thing I will have done for myself, and I'm excited. So please all join me and Juno Medical on a journey to make the world a happier and healthier place, no matter where you are and no matter where you come from. Thank you.
Thank you, Sophie, for this positive note at the end of the day. And I would like to pass the word to the cage, to Elizabeth and Bastian, to share some questions from Twitter, if you got some, or maybe some question that you can pose yourself.
Well, I was actually interested in your point of view on medical tourism. Now, of course, there's a lot of stigmas when it comes to medical tourism, the fear of danger, the fear of not receiving the quality of care that you are accustomed to in your own country. Last year, we had a similar conversation going on in here where there was a company that was actually also trying to sell doctors that coming from a different country and give them the possibility to provide care in Sweden. Do you think that is a little bit the same in this case, that you try to make healthcare in different countries help each other?
If you put it like this, yes, it is a little bit similar. How I like to think of it is in terms of a global healthcare pool. Nowadays, you can be almost anywhere in the world within 12 hours. Cost often is not an obstacle anymore for you to travel. A plane ticket hardly ever costs more than 200, 300 euros, right? And still, for healthcare, people are not tapping into this potential. I'm not saying that every patient should travel everywhere in the world to get healthcare, but I'm saying if you run out of options, you should consider an additional option that is there. So maybe it's similar in terms of how you try to allocate healthcare potential and healthcare availabilities in either bringing it into your own country or you go there. But again, I think for the patient, in order to enable the patient to make an informed decision, we need to increase awareness that there is actually an additional option for them.
And I also got a question regarding your presentation, if you can comment on it. When it comes to regulatory requirements in providing healthcare in different countries, how you, the platform, tackle these issues? Some maybe legal issues of providing care in different countries, or I don't know, some paperwork. How do you operate in so many countries simultaneously while being just 15 people?
Absolutely. So healthcare is a very complicated topic. So what we do is we are very careful in what we offer. We don't offer everything at this moment. We stay in the what I call lower complexity medical field. So we don't do heart bypass surgery yet, because that is something that we probably shouldn't do at the stage where we are at this company. But we do lower complexity medical procedures that enables patients to go get treatment in a simple way, as simple as it can get in healthcare, and come back and return safely home.
And just out of curiosity, how many people are using your platform at the moment?
Yeah. So all I can say is that we have been live for 5 months now. So we are a very young, early stage startup, and in all its forms. And we've been working with thousands of patients so far, from the US, the UK, Germany, and Austria, mostly.
Can I ask an additional question to that? Because I was very interested in that topic that you just rose, Dina. When you're looking at how healthcare is built up in Europe, a lot of the single-payer systems in Europe pay, at least if I'm explaining it correctly, they pay for care in the country itself, right?
Unless you can make arrangements. One of the things, like in the Netherlands, if you get hurt while you're abroad, they look at the total expense and they say, okay, it's not an emergency, we'll fly you home so you can be treated in the Netherlands, but if you go through the steps, you can be treated in another country, if that's what makes sense.
Okay, so if you're looking at that point of view, do you see yourself as a company in Europe in this as a man in the middle? Are you going to negotiate with insurance companies? Are you going to offer them the possibility to send people that, for instance, get a hip broken in the Netherlands to Germany because the treatment there is cheaper, or how are you going to situate that?
Yeah, absolutely. I think insurance companies is a really great topic. It's very fragmented, but I think, from, I said this before earlier today, insurance companies are a for-profit business, and medical travel is definitely poses huge potential for insurance companies to also work with people like us to actually not only save cost, but also bring higher quality to their customers.
Are you also going to be held responsible for the people that you advise? Or the companies or the hospitals that you recommend patients to go to? Yeah, so
the short answer is no. We are not providing medical advice. So we don't say, oh, we are doctors and you can you can come us for a medical consultation. All we do is we provide full transparency and information for the patients, and the patients come to us and they choose what they want. We never refer a patient to a very specific doctor or give medical advice. This is always something that the patient has to do with their own doctor or by themselves.
Okay, so the responsibility is still with the patient or the insurance company or the...
Exactly.
Ah, okay. Yeah.
It is like AirBNB model for medical tourism in some.
Yeah, I usually don't like to refer to the Uber off or the Airbnb off, but what I like about the Airbnb model is that they took a very fragmented market, a very complex thing, created a platform, took out the human factor, and let guests and hosts communicate with each other. And if you look at it from this lens, I would say yes.
Great. Any more questions from you guys?
Maybe I have more of a comment. I actually grew up with arguably the best. My family worked in the government, so I had the government insurance in the U.S. and I've traveled around a lot and had some rude awakenings as I got older in between changing countries and moving around that. One of the things that I really noticed, because I had insurance in the US, in the Netherlands, in Switzerland, in Australia, etc., is that there's really, everybody's good at different things, you know? And one of the things we see in the US is the Canadians sometimes come down to the US to get tests faster. The Americans come over to Canada to get things that they can't afford. That's on a basic rate. But how do you advise in terms of what country does what best? And is that part of it? Because I think there's a lot of opportunity there.
Yeah, absolutely. And I would even go one step further and don't even look at a country basis, but there are doctors who are doing, or hospitals who are better than others in doing one or the other thing. And this is exactly where we want to get to, right? So just as an example, what do you do when you are looking for a doctor nowadays and you don't know where to go? You ask your spouse, you ask your friend, you ask somebody who might know. And if you're in a lucky position to have somebody, you will find a great doctor, but most of patients don't. And this is what we want to stand for. We want to almost codify that human expert knowledge and make it accessible to patients. So if a patient comes to us with some rare cancer disease or whatever that is, we want to have a database where we can offer the patient treatment options based on the information that the patient gave to us.
Can I ask you, how is your company model formed? Are you getting profit, or are you getting paid by patients that are using your website, or is it paid by the government, paid by hospitals? How is it working?
So our service is free for the patient, and we want to stay free for the patient as long as we can, so forever, hopefully. We are being paid by the hospitals at this moment, not by government or anyone else.
And what's in it for them? Why are they paying for this?
They get patients, they get more revenue. Basically, they get more exposure to other patient groups that they might not reach without us. It's an international patient group, so lots of things that is in it for hospitals.
And how do you make sure that what they're saying they're good at, or what they're saying the reasons for patients to come to them? How do you kind of do a quality check with that?
Right?
Yeah. We do many things. So we look at all the facts to begin with. We look at the accreditations that they have, national, international. We look at the doctors that they have. We look at their education. We look at, their board certification, if they have one or if they don't. We also take patient opinions very much into account. We look at public opinions. We make sure to know about malpractice cases that have been in the hospital or with the doctor that we should know about. We take expert opinions into account. I'm a doctor myself. Doctors kind of always know where to go and which doctor to seek. And then we also follow our own patients throughout the whole journey to make sure that we know what is going on. And we work closely with the hospitals. We go visit them. We look at their facilities. So we do many, many, many things. And all that goes into our algorithm that actually then allows us to shortlist the hospitals and the doctors we want to work with and reach out to them.
So you're focusing right now, if I understand correctly, on a certain amount of treatments, right? Which
Yes.
of the treatments are you focusing on right now?
So right now, we are focusing on the lower complexity things. It's a lot of dental procedures, of course, lots of laparoscopic procedures, minimal invasive surgeries, a little bit plastic surgery. It's the largest field right now in medical tourism, and dermatology. So those are the four.
So the chances of actual big medical mix-ups or mess-ups is actually quite small in these.
Exactly.
But
yes.
is your future plan also to expand your field into bigger markets, like hip replacements or cardiac surgery, etc.,
Yes.
etc.?
Yes.
Okay.
We want to be able to help every patient who has a problem with healthcare and direct them to the right option. This is what we want to stand for.
Doesn't it make it very difficult in terms of European regulatory procedures that are in place right now?
It's definitely a challenge. It's one of many challenges that we face. But I think the thought of helping patients and providing them access to care is stronger than us being afraid of challenges.
I would like just to comment that this topic, why so many questions posted to you, because it's completely fresh for our discussion that we held during these 2 days.
Yeah, I think it's actually also what you mentioned before, being compared with an Uber for healthcare or Airbnb for healthcare. It's not a negative thing. It's actually quite a positive thing. I mean, they changed the whole world. The biggest taxi company is Uber, and they don't have any cars.
Well, and I love the idea, because we were talking about empowered patients before.
Yes, exactly.
I think this is empowered patients without borders.
Yes.
Exactly.
Yeah.
You're doing a great job, that's for sure.
Thank you very much. I like that, without borders. I'll take that.
That's why I'm sure we will have a really comprehensive interview with you guys afterwards in the cage, because this is a fresh topic.
No, no.
No? So that's why.
That's okay.
That's why we ask so many questions.
Yes, but please, everyone, feel free to contact Sophie in the networking area afterwards, and also they are on Twitter and online, and you can definitely connect.
And if you come to Berlin, drop me a line and come visit us, definitely.
Absolutely.
Absolutely.
Thank you so much, Sophie. This was truly inspiring. Thank you.